everyone, and thank you so much for taking time out of your day to join the NeedyMeds special topic webinar, The PAN Foundation, Connecting Underinsured Patients with the Treatment They Need. My name is Carla. I am the Director of Education and Partnerships at NeedyMeds. And before we get started, I just want to go over a few tips. You can feel free to type any questions you may have into that questions section of your GoToWebinar control panel. Just know that we will reserve answering questions until the end. If we don't have the time to answer your question, we will follow up with you personally via email. I will provide the contact information for NeedyMeds and the PAN Foundation at the end of this webinar. Also, this webinar is being recorded and will be available for viewing on our YouTube page. And you can find the PowerPoint slide decks in the handout section of your control panel. So with that, I just wanted to get started making sure that everybody was familiar with NeedyMeds. What you are looking at is our mission statement, our vision statement, and how we achieve that mission. But simply put, NeedyMeds connects people to programs that will help them afford their healthcare expenses. And we do this free and anonymously through our website, needymeds.org, and our helpline, 1-800-503-6897. I always like to put a screenshot of our homepage up during a presentation because our website is really the face of our organization. And it gives me a chance to point out just a couple of resources. If you are interested in locating healthcare cost savings resources, check out the Patient Savings tab. To stay up to date on what's new at NeedyMeds, check out the Advocates tab. This is where you can sign up to receive webinar announcements, sign up for a monthly newsletter, which is now named Vitals, and order brochures. In the beginning, I mentioned that this webinar is being recorded, and you will be able to find it on our YouTube channel, which is at the top right of our website with the other social media icons. Now, as you saw, a big part of our mission is education. And we define that by educating people about NeedyMeds and the resources we offer, but also by informing them of other resources, such as the PAN Foundation, which is why we are so pleased to have our guests Audrey and Joan with us today. So first, let me tell you a little bit about PAN. PAN helps underinsured people with life-threatening, chronic, and rare diseases get the medications and treatment they need by paying for their out-of-pocket costs and advocating for improved access and affordability. Now, let me tell you a bit about our guest hosts, Audrey Cordy and Dr. Joan Zhang. Audrey is the Manager of Provider Relations and helps to develop and implement PAN's provider outreach strategy. She has over 10 years of experience in the healthcare industry, focusing on insurance coverage, reimbursement, and access to care programs. She is a certified nuclear medicine technologist and holds a Bachelor of Science degree in business marketing from Syracuse University. Dr. Joan Zhang is the Manager of Medical Affairs at PAN and reviews the clinical parameters of PAN's assistance programs and conducts outreach to pharmacies and related professional groups. She is a licensed pharmacist with a Doctor of Pharmacy degree from Shenandoah University, Bernard J. Dunn School of Pharmacy. So without further ado, I'm going to pass the screen and the mic to Audrey. So please bear with us while we do that. It may just take a moment. And I will remind you while we're switching the screen over to our guest hosts that if you do have questions, you can feel free to type them into that question section of your GoToWebinar control panel at any time during the presentation. Just a reminder that we will reserve answering questions until the end. And of course, if we don't get the opportunity to answer your question, again, we will follow up with you via email. So with that, I'll go ahead and pass the mic to Audrey. Thanks, everybody, and enjoy the presentation.
Thank you, Carla. Hello, everyone, and thank you for joining us today to learn more about the Patient Access Network Foundation, or PAN for short. My name is Audrey. I'm Manager of Provider Relations here at PAN, and I'm joined today by my colleague, Dr. Joan Zhang, our Manager of Medical Affairs. Today, we'll walk you through what we do, why we do it, and how you can apply and receive assistance with PAN. First, let's start with why copay assistance is important. As you may already know, access to medically necessary treatment is critical for successful patient outcomes. However, this access is often blocked by high cost sharing, which can negatively impact both quality of life and the course of a disease. High cost sharing refers to healthcare expenses that are not covered by an individual's insurance plan and must be paid out of pocket by the patient. These out-of-pocket costs come in the form of deductibles, co-pays, and co-insurance. Patients who have insurance but are unable to afford the out-of-pocket costs associated with their treatments are considered underinsured. Additionally, you are considered underinsured if your treatment expenses are more than 10% of your annual income. For many people with chronic, rare, or life-threatening diseases, this cost of care can add up quickly, putting many patients in that underinsured population, which is an estimated 25 to 30 million people in the United States alone. This chart shows that an estimated 20% of the underinsured population struggle with cost sharing of $10,000 or more each year. Furthermore, limited access to prescription medications exclude economically vulnerable patients from the benefits of new, specialty, high-cost generic, and other medically necessary high-cost prescription medications. Advancements in new therapies could also mean even higher prescription cost sharing, and this increasing burden will once again fall directly on the patient, which means that the patients who are already having difficulty paying for their out-of-pocket cost will also pay more to simply maintain their health insurance. So not only do patients face high out-of-pocket costs, but most patients are hit with the highest out-of-pocket cost at the beginning of the year. And it is unlikely that we will see any major structural changes to our healthcare system in the short term. And so cost sharing remains a high priority and a high risk. The Patient Access Network Foundation believes that cost sharing should not prevent anyone from obtaining medically necessary treatment. And so today, we are going to tell you how PAN can help remove the financial barriers and alleviate high out-of-pocket costs for the underinsured. So without further ado, I will turn it over to my colleague Joan, who will tell you more.
Thank you, Audrey. Let me begin by telling you who we are and how to apply for assistance with PAN. The PAN Foundation is a nonprofit organization dedicated to helping federal and commercial insured patients by helping them pay their out-of-pocket expenses or cost-sharing expenses for their prescribed medications. We have three types of assistance programs. First, we have co-pay assistance programs, which includes assistance with payments for deductibles, co-pays, and co-insurance. We also have premium assistance programs, which assist with the patient's insurance premium payments. And lastly, we have travel assistance programs, which help to cover the cost of approved transportation, lodging, and ancillary travel expenses incurred for your patient's treatment visits. All of our assistance programs are provided in the form of financial grants. Since its founding in 2004, PAN has provided nearly 1 million underinsured patients with over $3 billion in financial assistance through more than 60 disease-specific programs. Listed on this slide are some of the disease funds that we have available at the PAN Foundation. They range from chronic diseases to oncology and rare diseases. To see a full listing and current statuses for our programs, please visit our website at panfoundation.org. To qualify for assistance for one of our disease funds, the patient must meet the following criteria. 1. The patient must be getting treatment for the disease fund in which he or she is applying. This means that if you are applying for the assistance with our asthma disease fund, the patient must be diagnosed with asthma and the medication you are seeking assistance with must be covered under an asthma fund formulary. 2. The patient must have health insurance that covers his or her qualifying medication or product. 3. The patient's medication or product must be listed on PAN's list of covered medications. 4. The patient's income must fall at or below 400 or 500% of the federal poverty level. It's important to note that the insurance and income criteria vary for each program. So be sure to verify this in all of the program guidelines on each disease fund page at panfoundation.org. And finally, 5, the patient must live and receive treatment in the United States or U.S. territories, although U.S. citizenship is not a requirement. If your patient meets all of the criteria listed on the previous slide, you will need to gather the following information before you start the application process. You will need the patient's demographic information, such as name, address, phone number, and email address. You will also need the patient's diagnosis and medication name, as well as their health insurance information. You will also need the patient's income and number of people in the patient's household. And lastly, you need the physician and facility's contact information. Now you are ready to apply for assistance with PAN. There are 2 main ways to do this. You can either give us a call Monday through Friday from 9 a.m. to 7 p.m. Eastern Standard Time at 866-316-7263, or you can log on to one of our 3 self-service portals listed here. As you can see, each portal is designed with the end user group in mind. The provider portal services our healthcare providers, whereas our pharmacy portal is intended to serve our pharmacy personnel. Lastly, our patient portal is designed to serve our patients and patient caregivers. On average, it takes about 7 minutes to complete an application, and our enrollment decision takes about 1 minute. We'll provide you with the patient's enrollment information, and then we follow up with a fax enrollment letter to the physician and a mailed letter to the patient advising them of their enrollment details. Once you are enrolled, you can begin submitting claims to PAN immediately. We want the reimbursement process to be simple and quick for you, so we provide several ways for you to submit your claims. 1. If patient receives the medication from the pharmacy can bill PAN electronically or submit a claim via fax. 2. If the patient receives medication from the doctor's office, the doctor can bill PAN electronically, by fax, or via the provider portal. 3. If the patient prefers to bill PAN directly, the patient can submit the prescription label or remittance advice for services rendered at the pharmacy, or an explanation of benefits for services rendered at the doctor's office, all along with a complete direct member reimbursement form. Additional information on filing claims can be found on our website at panfoundation.org under How to File a Claim for each user. We'll also make sure to communicate with you every step of the way until you receive your payment. Now that you have enrolled your patient and are ready to submit claims, there are a few things to know about PAN's grants. Each PAN grant eligibility period is for 12 months. However, if your patient enrolls with PAN for the first time in any of our disease funds, we will help cover their claim incurred in the last 90 days before the date of enrollment. In addition, claims must be submitted every 120 days in order to keep the grant open. You may apply for renewal grants with PAN after the 12-month eligibility period ends. PAN also offers additional assistance called second grants for all our disease funds. This means that if the disease fund is open at PAN and your patient runs out of funding before their enrollment period ends, you can apply for a second grant to cover the remainder of the patient's eligibility period. You may still have additional questions pertaining to your specific situation, please contact us and we will assist you through every step of the process. We understand that managing an illness is difficult, and people who apply for assistance from PAN may need support beyond financial assistance. They may have questions about their disease, treatment, side effects, and medication adherence. And they may benefit from connecting with a compassionate community that can help them deal with the physical and emotional complexities of their disease. That's why we have formed alliances with leading patient advocacy groups such as the American Liver Foundation and Parkinson's Foundation, to name a few, to provide patients with the holistic support they need. These groups will reach out directly to patients who are interested in learning more. I am really excited that I have this opportunity to tell you about our programs, and I hope you will refer your patients to PAN so they can benefit from the assistance that we have available here at the PAN Foundation. And now I will turn it back over to Audrey.
Thank you, Joan. So we want to encourage you to stay connected with us once you enroll your patient with PAN. We understand that you have a busy schedule, and because of that, we've made our process quick and simple for you to stay connected. We provide many resources to help you along the way. And one of the resources that we have is through the patient portal. Here, a patient can apply to PAN by simply going to www.panapply.org to complete a short online application. And once enrolled, a patient or caregiver can manage their account, review their eligibility period and grant balances, sign up for a second grant if they are out of funds, renew their grant starting from 1 month before the date in which their eligibility period ends, and finally, view corresponding letters regarding their account. All this can be done without picking up the phone. If you are a provider, and you may also apply on behalf of your patient at the providerportal.panfoundation.org. Here, you can utilize the same features as on the patient portal with some additional features such as submit and view process claims and run reports. You can communicate with our portal support team via our secure messaging tool, and you can access all PAN correspondence letters regarding your patient's accounts and manage your facility accounts. Pharmacies may also log on to the pharmacy portal at pharmacyportal.panfoundation.org and utilize the same features as on the provider portal with the exception of claim submission. In addition, PAN announcements and updates are displayed on both provider and pharmacy portal login pages, and this is to help keep you updated as to what is new at PAN. Another great resource is our website. We have designed specific sections for our providers, pharmacies, and most importantly, our patients. By navigating the top menu bar, you can access audience-specific tips and tools to find program information. For instance, on the provider and pharmacy section, we have a page on frequently asked questions, which provides further details about how to enroll your patients and file a claim for reimbursement. We also have short webinars about our programs on each section, as well as some additional resources for you and your patients under the advocacy resource pages. On the patient section, you will find a list of all our assistance programs and the fund eligibility criteria, as well as the fund formulary. On the disease fund page under the patient section, you will also see referral information to other foundations if the disease fund is closed at PAN. To receive notification via email when the disease fund opens again at PAN, you can sign up for our fund reopen notification list on our portals or by calling us. In addition to our fund reopen notification list, PAN created a web-based app called Fund Finder. This is to help you track disease fund statuses across all of the 8 charitable copay assistance foundations, including PAN. You can simply go to Fund Finder at panfoundation.org, or you can find the link on our website to sign up. Once you sign up, you may follow any disease fund and you will receive notification alerts via email or text message when the specific disease fund opens at any of the foundations. Fund Finder helps you save time by not having to frequently check multiple websites for fund statuses. Our goal here is to help you find the support and resources you need so you can spend less time on the manual paperwork and more time with your patients. We know that PAN Foundation is one of many resources to help you and your patients. So we encourage you to reach out to us so we can listen to your needs and understand how we can help. If you have any questions or if you have a patient in need, please let us know. Our contact information is listed on the screen. You can reach me directly at 202-370-4824 or email me at acorte@panfoundation.org. We look forward to working with you soon. And thank you so much for your time today and for all that you do. And at this time, I'll go ahead and turn it back over to Carla.
Audrey and Joan, thank you so much for that very thorough and easy to understand presentation. No doubt our audience is getting a sense of why we are so proud of our partnership with the PAN Foundation. A reminder that if you do have questions, you can submit them into that questions section. I already see a bunch coming in of that GoToWebinar control panel. And while those questions are coming in, and before we ask them of Audrey and Joan, I just want to make sure that you remember NeedyMeds as also a source of support on trying to help yourself, your family members, or your patients save on their healthcare expenses. On your screen are our most popular and cost-effective healthcare cost savings resources that we do hope you take advantage of. And to learn more, you can sign up for one of our upcoming monthly overview webinars. You can find those on the calendar of events on the bottom right hand of the NeedyMeds homepage. Or if you're looking for help affording a specific medication or healthcare expense, our call center counselors at 1-800-503-6897 are here to help. Just a reminder that we are open Monday through Friday, 9 to 5, but we are in Massachusetts on East Coast time. So with that, I'm going to go ahead and leave up that contact information Audrey just shared with you. And let's get to those questions coming in. So the first one is, and this is a good question, when applying for assistance, do I need to provide any paper documents to verify my income?
So when you initially apply for assistance with PAN, that process usually takes about 7 minutes, and you don't need to provide your paper documentation right away. What we'll do is that we will request for you to provide us the household income at the time of the enrollment. And we'll go ahead and process and approve the application. And if later on down the line when we're doing an income verification and we recognize that when the information that was provided is not matching with what is on file, then we will reach out to you and request paper documentation. But initially, it's not required, and for most applications, we don't usually require that.
Thank you so much, and thanks to our audience member for asking that, because I always feel like if you're thinking about it, then probably somebody else is too. So we appreciate you giving us the opportunity to clarify or address some new information. So another question coming in is, why do I have to submit a claim every 120 days to keep my grant?
We want to ensure that our grant recipients are using their grants as intended. And so if we do not receive a paid claim within those 4 months, the grant will be canceled and we will make the released grant available to another patient who needs assistance. Of course, if there's any extenuating circumstances, please contact us.
Great, and I think that's an important sentiment, that if you do have any questions, certainly reach out to Audrey directly or call that call center number on the screen. certainly they'll be able to help you. Another question coming in, how often are PANS programs available?
So PAN assistance programs are usually, we make it available when we receive funding for the program. And so there's no way to really determine when it's going to be open until we actually receive funding for it. And so there's no way to determine that. But however, that's why there's certain tools that we put in place is helpful, like the fund finder, so that once it opens, if you follow that particular disease fund, once it opens, you will get a notification for it. But because we rely on our generous donors, that we don't, we can't anticipate when it will be open. But as soon as we get funding, we make sure that we open the fund as soon as possible, within days, a day or two at most.
That's wonderful. And that actually addresses, I believe, another question that an audience member asked, which was, how are new diseases for support added? Or is there a way to add new diseases for support?
Sure. So if there's a disease fund that you are interested in, but you go on the website and you don't see that disease fund listed, you can contact PAN, or also on the website under the assistance programs, there is an opportunity for you to send us a message there as well to let us know the name of the disease fund. And what we do is that we usually try to do some research to find out if there's a market for it, and see if it's going to be a viable or sustainable. And then from that point on, we'll make the decision to see if it can be an added fund or something that we're not able to pursue at the time. But if you have any disease fund or even a medication, if it's not covered under a specific disease fund, if you wanted to find out if it would be covered, then you can send us that information, or you can give us a call and we'll take a look at it.
Great, thank you. And we talked about Fund Finder, and a question coming in specifically about that is, can you participate in that if you don't have an email address?
So for Fund Finder, you will only need the email address when you initially sign up. And the purpose behind that is that we will send an email to verify your registration. However, once you're all signed up, you can actually opt out to only receive text message notifications. So you will not need to use your email if you do not want to.
Great, that's very helpful. So as I had mentioned in the beginning, we do keep the questions segment of our presentations brief. So if we didn't get the chance to answer your specific question, again, we will follow up with you via email. Of course, if you do have questions in the meantime, you can reach out to Audrey directly at that number on your screen, as well as the PAN Foundation call center, which is 1-866-316-7263. And a reminder that we do also hope that you rely on NeedyMeds as a source of support to getting help affording your medications and other healthcare expenses. Check out our website further, especially that patient savings tab at needymeds.org, or give our expert call center counselors a call at 1-800-503-6897. With that, thanks again for taking the time to join us, and we do hope you stay in touch. And thanks so much to our partners at the PAN Foundation, Audrey and Joan, for taking time out of their day to share their expertise with the NeedyMeds audience. Thank you, everyone.
Thank you, Carla.
Thank you.
And thank you, everyone, for joining.